Hi, I'm Gina Terlizzi with the Missouri Department of Health and Senior Services, and I'm here with the Missouri Nutrition Success Story. As adults, we understand the importance of eating right, picking the right foods, controlling portion sizes, and being mindful of what we choose to put into our bodies. Passing those habits along to our children is incredibly important, and the Missouri Department of Health and Senior Services is excited to share information on a new initiative to teach these healthy eating habits to our state's smallest citizens. We visited one Missouri child care center that has implemented the EatSmart program to find out how they did it, the challenges they faced, and what the results have been. Tanya Ryherd is the cook at the Community Child Development Center in Macon, Missouri. Today, she's hard at work preparing lunches that include bananas, mangoes, and vegetable soup. It's all part of being an EatSmart child care center. They serve fewer processed food items and focus on real foods, fruits, vegetables, low-fat dairy, and whole grains. And it's not just what's being served, but how it's being served. The kids pass items around the table and dish up their own servings onto their own plates. Center Director Patricia Knowles says the push to become EatSmart all began with a community garden.
Community Child Development Center became an EatSmart Child Care because we had the opportunity to develop a center garden with some of our community partners. In that process, we began to study and read about all the obesity epidemic and all the lack of nutrition that young children were suffering from. So when the EatSmart opportunity came, we decided to jump on board.
Missouri child care centers who participate in the Missouri EatSmart Child Care Initiative are helping Missouri children learn to make smart food choices. The program requires participating child care centers to meet the Missouri EatSmart guidelines, which provide specific nutrition policy recommendations above the standards set by the United States Department of Agriculture. Knowles says it took a while for everyone to adjust to the EatSmart guidelines.
The reactions that we had from the children and the parents were varied depending upon them. The children had the opportunity to try lots of new kinds of foods, and they welcome that like they welcome any new activity with enthusiasm. A lot of times parents just have a question, so you just have to stop and talk to them about what their question is at that point.
But it's been successful, and now the kids have their own garden right at the daycare so they can learn where some of that healthy food comes from.
It kind of varies as to how much of the product we actually get to eat, but we do eat it. I can remember taking a strawberry and cutting it into 10 pieces so that 10 different children could have a taste of that one strawberry. And they were just as thrilled as if we'd given them a whole pint of strawberries.
But the larger lesson is one that will hopefully stick with these children in the form of healthy eating habits throughout their lives.
I think becoming an EatSmart Child Care Center has been very beneficial because it's just brought nutrition to the forefront. It's helped us become aware of what we're serving and why we're serving it and how we're serving it, and the things that we're teaching young children through these meals and snacks that we serve every day.
The Community Child Development Center hopes to renovate the center kitchen in the future. The plan is to incorporate more pantry space and a bigger refrigerator so they can save money by buying more of that healthy food in bulk. To learn more about the program and the EatSmart guidelines, visit us online at health.mo.gov/EatSmart.